Welcome, everyone. I'm Katie Arna, the Executive Director at Canadian Doctors for Medicare. We're really excited for the conversation we're going to be having this evening and really honored to have such amazing guests with us. So before I get started and hand things over to our moderator for this evening, I would first like to acknowledge that while we're meeting virtually this evening or afternoon, depending on where you are, the CDM office, as well as my home from which I'm participating this evening, are both located on the traditional territory of the Wendat, the Anishinaabeg, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. Toronto is within the lands protected by the Dish with One Spoon Wampum Agreement. The dish represents the land that is to be shared peacefully, and the spoon represents the individuals living on and using the resources of the land in a spirit of mutual cooperation. This agreement captures our responsibility not only to the land, but to one another as well, which is particularly meaningful given the conversation we're about to have. As you're probably joining from all across the country or even the continent, I encourage you to consider the traditional territories upon which you live and work. We must also recognize and underscore the significant and unjust health disparities that Indigenous people continue to face today due to systemic racism and the ongoing effects of colonialism. So at CDM, we're committed to working to reduce these inequities as part of our work to advocate for better Medicare. And without further ado, I'd like to introduce you to Andriy Katyukha, who will be moderating the event tonight.
Thanks so much, Katie. Hi, everyone. My name's Andriy Katyukha, and I wanted to start off by just thanking Zarif and Katie for really playing an instrumental role in organizing this event, and to our speakers as well. I'm currently serving in the student position on the CDM Board of Directors, and I'm an incoming internal medicine resident at the University of Toronto. So for anybody on the call that's new to our organization and joining us for the first time, we're a national organization that is really focused on evidence-based kind of ways to actually preserve and strengthen our publicly funded healthcare system. We operate in a nonpartisan fashion, and we kind of take great ideas from across the aisle and really try to be create kind of bridges for ideas and ensure that we're really advocating for innovations that are really evidence-based and improving access, quality and equity and sustainability of the healthcare system. Zarif is going to post a link to join the organization for some of you who may be interested and are not members currently. And I'd like to turn your attention to that if you wish. So we're really, really happy to have you join us tonight to discuss this really important topic, our Better Medicare webinar on health and climate. This is the first time we're having a webinar on this topic, and it's a really important discussion kind of in the current context, given its impacts on both our society and healthcare more broadly. As we know, climate change is already negatively impacting the health of Canadians, disrupting food systems, our supply chain, affecting our water, the air that we breathe. And more importantly, it's also disproportionately impacting marginalized communities and Indigenous communities. And we really think that in order to advocate for a better healthcare system, we really need to understand the links between health and climate. And it's really exciting for us to be hosting this panel today. And kind of with that being said, and that context being provided, I wanted to really introduce our esteemed speaker list. It's really a pleasure to have all of you here. So first up is Dr. Samantha Green. Dr. Samantha Green's a family physician at St. Michael's Hospital in Toronto and at the Inner City Health Associates in Toronto. She's also a faculty lead in climate change and health at the University of Toronto's Department of Family and Community Medicine, and is a board member of the Canadian Association of Physicians for the Environment. Next up, we have Dylan Penner, who's a climate and social justice campaigner at the Council of Canadians. And he has been campaigning, organizing, and building coalitions with a range of social movements for over 20 years. He is supporting grassroots organizing from coast to coast to build a just transition to a Green New Deal from the ground up, and organizing in solidarity with Indigenous-led resistance to the expansion of fossil fuel projects. And you can follow him on Twitter. I think all three of our speakers are on Twitter, and his handle's Dylan Penner. And you can also find Dr. Green and Dr. Howard on Twitter as well. And our last speaker is Dr. Courtney Howard. She's an emergency physician in Yellowknife in the subarctic, and is a clinical associate professor in the Cummings School of Medicine at the University of Calgary. Dr. Howard is a nationally and globally recognized expert on the impact of climate change on health, and in the broader discipline of planetary health. So once again, thank you very much for joining us and participating in this discussion. And we really look forward to hearing some of your thoughts. So my first question is going to be to Dr. Green, and how this will work. We have questions for each of our panelists, and they'll provide about 10 to 15 minutes of commentary on that topic. And then we can follow up with other questions later. So for Dr. Green, just to get us started, would you mind discussing and going over some of the health impacts of climate change for our audience?
So, yeah, I just wanted to provide a broad background on the climate emergency, including the health impacts. But I think I wanted to even step back a little bit further before delving into the health impacts, if that's okay. And a lot of this, Courtney and I collaborate greatly on this work. So, a lot of this we've kind of developed together, or, in collaboration with each other. I feel uncomfortable presenting on climate change to Courtney. Anyways, so this is the problem that we're dealing with. These stripes represent global average temperature from 1850 to today. We are currently at 1.2 degrees of warming, and the Intergovernmental Panel on Climate Change's latest report says we will almost certainly hit 1.5 degrees of warming by 2040-ish. And that report said we must act now and immediately reduce emissions to avoid warming more than 1.5 degrees. And we know, based on modeling, that every fraction of a degree above 1.5 could translate into literally millions of lives lost. And more than that, as the world warms, we risk reaching tipping points where we could be stuck with irreversible warming incompatible with human life. And current trends indicate that without a much more determined worldwide response, temperatures will go on rising to at least 3.2 degrees by century's end, which is double what the world agreed to in Paris in 2016. These are the stripes for Canada. And as you can see, Canada is warming at twice the global rate, and the Arctic is warming at 5 times the global rate. And this graph represents 5 possible scenarios for our future, and only the blue very low emissions scenario actually limits warming to 1.5 degrees. All of these other scenarios reach above that 1.5 degree limit. I'm showing this graph also just to demonstrate that, as I said, we are committed to further warming. So at least that 1.5 degree mark by 2040-ish. That translates to warming in Canada by a further 2 degrees by 2040. And we're currently actually we are currently tracking along the red line there, the very high emissions curve, which projects about 6 degrees of warming in Canada for 2080. And finally, the latest Intergovernmental Panel on Climate Change report, the third part that was released in April, says that global emissions must peak by 2025, and we need to have global emissions by 2030 to have a chance at 1.5 degrees. So just let that sink in. We need to have global emissions by 2030 to have a chance at 1.5 degrees. And you may think, well, we're in Canada. We're just a small country. We don't really contribute that much, but we are responsible for 1.6% of global emissions, which makes us the number 9 global emitter in absolute terms. And we are also among the top 3 emitters per capita at 21 tons per person per year. And furthermore, and I think the vast majority of people in Canada don't realize this, we are, of course, a top fossil fuel producer and exporter, and the oil and gas that we extract and export is not counted in our own emissions or our own emission reduction targets, right? It counts where it's burned. But that means we play a significantly disproportionate role in the climate emergency. And climate change is the biggest threat to health that we face, and that's been recognized for decades now. And when we think about how climate change, and finally answering your question, how does climate change affect health? I mean, you've all seen this, I'm sure. This infographic was published by the CMA in 2009. At the time, it was like a really big deal that Canada's big group of doctors was finally recognizing that half of someone's health is determined by the social determinants of health. Just 25% is related to what we do in healthcare. 15% is biology. And then, you see at the bottom there, the little sliver, 10% is related to the environment. I mean, I imagine that 10% is growing with the climate emergency. But not only that, I do think this infographic does a bit of a disservice to how fundamental that 10% is. So this is actually Dr. Howard's image that she created, which I think does a better job of just illustrating how fundamental those ecological determinants of health are. Because without clean air, clean drinking water, without a stable planet, I mean, nothing else really matters. And then this was also, a map that I think Courtney helped create. It was published in the Lancet Countdown 2019 report for Canada. So annually, the Lancet publishes the Lancet Countdown on Health and Climate Change at the end of each calendar year. And there are country-specific reports that are also released. And so this is from the 2019 Canada report. Just a map kind of outlining all the health effects across the country. Even just in the last year, we've seen those impacts. If tomorrow is the 1-year anniversary of the heat dome event in British Columbia, where we know about 700 people died. Of course, we also saw crop failure in droughts across the prairies, which has led to a direct increase in food prices in grocery stores across the country. Flooding took out entire communities in British Columbia and Newfoundland, causing injury and disrupting access to health services. And wildfires engulfed large parts of Western Canada and Northern Ontario, leading to direct injury, mental health impacts. And then, of course, wildfire smoke can trigger exacerbations of respiratory disease, cardiovascular disease, as well as poor diabetes control, poor pregnancy outcomes. And then, of course, we're also seeing an increase in Lyme disease in Canada. Globally, we are seeing an increase in malaria, West Nile virus, dengue, and Zika. And then while there is no confirmed link between COVID-19 and climate change, we do know that climate change will be a driver of future pandemics. I guess displacement, which I've kind of alluded to, is another big indirect impact of climate change. Climate change was one contributor to the Syrian war and the Syrian refugee crisis. It's also a contributor to the migrant crisis in Central America with drought and multiple hurricanes there. And so those are the impacts. And those whose health is most affected by climate change are those who are already most vulnerable and marginalized: Indigenous people, racialized people, who are living in poverty, and others who are politically marginalized. Those who are poor or racialized are less likely to have access to air conditioning, for example, are more likely to live in neighborhoods with poor tree cover that are affected by the urban heat island effect, which can make those neighborhoods up to 12 degrees hotter than surrounding communities. And then people with low income are less able to cope with rising food prices, less likely to have insurance or money to rebuild or relocate after an extreme weather event. So what can we do about this as health professionals? The way I've framed it is we can and need to do three things. Number one is adaptation. So we need to be aware of changing patterns of disease, and we need to intervene with individual patients, including providing anticipatory guidance and preventative counseling. So we need to become experts at heat exhaustion, heat stroke. We need to know which of our patients are at risk of those conditions. We need to be giving them like asthma action plans for wildfire season, for example. We need to be aware of which medications put patients at risk, which medications are not stable in the heat. So there's a whole level of knowledge that we need. And then on a systems level, healthcare facilities are also potentially at risk of harm. So this is the hospital in Fort McMurray that had to be evacuated during forest fires there. And, globally, I don't know if you remember Hurricane Maria, which hit Puerto Rico a few years ago, but it took out the world's leading saline manufacturer, leading to IV fluid shortages around the world. I was just talking to the chief sustainability officer at UHN, and, they're planning for the horrible scenario, but very, not unlikely, of a blackout paired with a heat event, and how they would manage that at their enormous hospital. So this kind of planning needs to happen. Then there's mitigation. So the Canadian healthcare system contributes 4.6% of Canada's total emissions, which is about on par with the aviation sector here in Canada. And if the global healthcare sector were a country, it would be the 5th largest emitter on the planet. And we're also particularly polluting in our healthcare system here in Canada. We are the number 2 most carbon intensive health system in the world after the US. And so obviously there's lots of room for improvement there. And the NHS has done a lot of work on this. They're the global leader on sustainability and emission reductions. They actually have a goal of net zero by 2040 and an 80% reduction by 2028. So they've measured where those emissions are coming from. And so this is from NHS data here. And you can see that 70% of the emissions are from medicines, medical equipment, supply chain, which really translates into the healthcare that we provide, the work that we do, not the buildings, which maybe comes top of mind, but the buildings just account for 10%, and certainly not the waste, which is what's visible. We always see all this terrible waste and hate throwing it away, but that's only 5% of emissions. So obviously it's significant. We need to reduce waste, but it's not the bulk of healthcare emissions. And there is this model, which I obviously don't have time to get into, but developed by Dr. Andriy Katyukha, who's a surgeon in Vancouver, for what a sustainable health system might look like. And I think this is where there's like a lot of synergies with CDM's work, because, every activity that we do in the health system creates emissions. So a big thing that we can do is prevent people needing that healthcare. So we can address the social determinants of health, engage in health promotion, disease prevention, chronic disease management, and also, things like pharmacare, access to public physiotherapy so that people don't end up with like end-stage disease before and need like expensive interventions. So anyways, that's in that first red section, reduce demand for health services. Then there's match supply of health services to demand. So basically choosing wisely, don't order unnecessary tests, because not only are you causing harm to the patient, costing money, but you're also causing emissions. And then finally, at the bottom there, reduce emissions from the supply of health services themselves. And there's a bunch of things that can be done there. And the nice thing is, there is a growing movement to engage in sustainability in the health system. Canada actually signed on to the WHO COP26 program at the last climate meetings in the winter, which committed us to developing a climate resilient, low carbon health system. How that will translate from federal to provincial, we will see. I think Courtney might have some insider information on that. But there is growing momentum. It's also now one of the top 5 priorities of the CMA's strategic plan, engaging in sustainable healthcare, largely thanks to Courtney, because she is on the CMA board. And there are, of course, increasing numbers of physicians and health professionals thinking about this. And then I promised you 3 things we can do. And the third thing is leadership and advocacy. So climate communication scientist Ed Maybach has said that we need simple, clear messages repeated often by a variety of trusted voices to affect change on the climate crisis. And we are trusted voices. If you see here, primary care doctor, are most trusted to speak about climate change. So this is an American study, about 1,200 people. But amongst those people, the vast majority trust primary care doctors over everyone else to speak about the climate emergency. And, we can all take action on climate change by speaking about it as a health issue, because I think still it is not viewed necessarily as a health issue. So we can even just, talk to our friends and family and neighbors and political representatives about the climate health emergency. And then finally, I think this is my final slide. Apologies if I took too much time, but the other role that we have to play is talking about health co-benefits, because many of the policies we need to mitigate the climate emergency actually have immediate health co-benefits. And people really like to hear good news. And so, for example, the WHO has estimated 1 million lives a year saved from air pollution alone by 2050 if we were to meet the Paris Climate Agreement. So many of the things that we can advocate for will have these immediate health benefits.
Thank you very, very much for that broad overview. And I think it's so important that you linked kind of the role of CDM and what we're trying to advocate for and how that impacts climate change and creating a sustainable healthcare system. So thank you for that. That was a really lovely overview. And next we have Dylan Penner. So moving on to you, Dylan, kind of based on your experiences and your understanding and the work that you're doing, how central are Indigenous rights when we talk about health and climate? And specifically, when we start thinking about a way forward and addressing some of these issues, how do we create a plan for a Green New Deal that also challenges institutional racism, colonialism, and imperialism?
Firstly, thanks for having me here. Great to be gathering with all of you. And really, we're facing intersecting crises that need to be addressed together. And so when it comes to climate and health and colonialism, there are very deep interconnections. In terms of racism and colonialism, there are direct impacts on both the kinds of social and ecological determinants of health that Samantha was talking about for Black, Indigenous, and people of color. And it's also an inherent feature of resource extraction, including fossil fuels. So tackling racism and colonialism really needs to go hand in hand with climate and health organizing and with building a just transition for workers and communities. And that's really, I think, what needs to be at the core of the kind of transformative change through a Green New Deal that we need. And a really core part of this, I think that's worth underscoring is that Indigenous resistance to fossil fuel projects has stopped or delayed projects equal to 25% of US and Canadian emissions. And very much recommend the report on that the Indigenous Environmental Network put out last year. And so Indigenous rights and Indigenous sovereignty are climate solutions. One example that's a good through line for folks who haven't followed it is 1492 Land Back Lane. And I would really recommend looking into this situation if you haven't so far. 1492 Land Back Lane really highlights the intersections between things like sprawl and housing and climate and colonialism and poverty and social and ecological determinants of health. There's been really amazing solidarity with Land Back Lane from the labor movement and all of the work that the labor movement has been doing through that solidarity. I think it really highlights the kind of work that we can be doing to build a Green New Deal for that makes the connections between public housing and Indigenous sovereignty and just transition and public health, and really highlights how we could be moving towards a system change in housing to make it public, universal, decarbonized, and decolonized, and as part of fighting sprawl, fighting colonialism and the climate crisis, while at the same time improving social determinants of health. So that's just one example of the kinds of connections that we can be making in recognizing, as Samantha was talking about, that the climate crisis really is a public health emergency. And we need to recognize that the root causes of the climate crisis, including colonialism, environmental racism, and the exploitation of workers, are a public health emergency too. And so that is just part of why we need a Green New Deal for public health care. A Green New Deal is really one of the most powerful strategies available to unite our movements in a common struggle to defend and expand public services, including healthcare. A Green New Deal can address the 1%'s attacks on the climate and public health care. It can fight pollution and privatization. At the core of a Green New Deal is a just transition, which prioritizes the support for impacted workers and communities through the inevitable transition that's necessary to address the climate crisis. And this, of course, includes fossil fuel workers and workers across the entire economy, such as transportation, education, food, housing, and healthcare work. And so a Green New Deal can really create a shield around public healthcare as part of what it does to protect it from vulture capitalists and the system that wants to cut and privatize and trade away any and every public service that it can get its hands on. And for decades, our opponents of our movements have tried to reframe the debate so that they can destroy Medicare. And now there's a full frontal assault on healthcare, of course, and other public services being waged by conservative premiers, even in the midst of this global pandemic. Healthcare advocates have long been calling for the expansion of our public healthcare system to include key services that aren't currently covered, as well as environmental and occupational health. And doing so would create a stronger Medicare system with more green jobs in the process. So a Green New Deal is a powerful tool to reframe the debate. It's a way that we can and we can pay for it by taxing corporations and billionaires to pay for the crisis that they created through a Green New Deal that includes universal public health care for all, that includes pharmacare and dental and vision and hearing and mental health. And that's all the more reason strategically to unite our movements for public health care and climate justice, because working together, we can win both. An alliance of patients, healthcare workers and their unions, students, anti-poverty and social justice activists, environmentalists, Black, Indigenous, and people of color, and more can defend and expand our public healthcare system in the face of the climate emergency. And we can build that alliance by organizing for a Green New Deal for public healthcare that's rooted in a just transition. And part of that is recognizing the climate crisis as a public health workplace issue, and it's about all of us. And we have a collective responsibility to ensure a just transition for those most impacted. So a just transition and a Green New Deal can address these intersections of climate justice and racism and healthcare. And one doctor I keep coming back to, former Detroit Health Director Abdul El Sayed, has written really powerfully on the importance of a Green New Deal that addresses the public health impacts of environmental racism, the prison industrial complex, and inequality. And he wrote in The Guardian, I think it was 2 or 3 years ago, that he, quote, realized that the forces that cause climate change are the same forces that poisoned the lungs of babies in his city. He realized that by eliminating the local consequences of fossil fuel emissions and lifting whole communities out of poverty, the Green New Deal will also be a public health New Deal. So people should have access to healthcare without fear of detention or deportation as well, regardless of immigration status, especially in a time of climate crisis that is increasing migration and displacement. And all of this is happening in a context where opponents of Medicare have always tried to create or take advantage of crises to justify privatization. We've seen this across the public sector, including healthcare. And so let's not be surprised if and when they try and use the growing strains of the climate crisis and the pandemic on the healthcare system as a new pretext for its privatization. Some premiers have already used the pandemic as cover to do just that. So let's get ahead of that and cut off that line of attack before they even have a chance, by being crystal clear that the solution to the climate impacts and other strains on healthcare is not privatization. It's a Green New Deal for universal public healthcare for all. Thanks, and I'll leave it there for now.
Thank you very much, Dylan. That was wonderful. I just wanted to acknowledge Betty Jane. If we're going to have questions at once the third speaker is done speaking, and then you're welcome to ask your question. Then you can also add it in the chat. If possible as well. And our last speaker is Dr. Courtney Howard. So kind of turning it over to you, Dr. Howard, how would you explain the significance of health systems when thinking about climate change? Do you have recommendations for CDM and CDM members and advocates when we think about decarbonizing health systems and supply chains? Do you have any practical ways that we can go about doing this and advocating for this change?
Yes, thank you. And thanks very much. I always enjoy hearing other people present on climate change and health. So thanks to Sam, and thank you, Dylan, for your perspectives in decolonization. And I 100% agree with both of you. I think our challenge now is to create an integrated narrative and plan so that we're all pushing for the same thing. And the beauty of it is we kind of are. If you looked at that infographic that Sam showed that Andrea McNeil put together, as Naomi Klein actually pointed out in her book, the climate crisis is the best reason we've ever had to do what we needed to do anyway. And so it's really a new reason to push for support for public health, to push for support for the social determinants of health, to push for us to make sure that the things that we really, really need to happen are probably going to be brought about through the public system, because that's just the best way to make sure that we're resilient. And so I think when I look at what CDM is doing, I think that the place that really jumps out to me the most is really around the pharmacare discussion and the supply chain there. The thing, I've worked with Médecins Sans Frontières, Doctors Without Borders, and I also live at the end of a very long solitary highway. So supply chain issues are something that really come to the fore. So you'll find when you have conversations about this, that despite the fact that there is a Journal of Climate Change and Health, and the Lancet has had a Journal of Planetary Health since 2015, most docs don't know anything about it. Curriculum surveys show that only about 10% of us are getting taught about it. The nurses have started to do, public health has started to do some of those surveys as well. The numbers are still pretty low. So when you go into these discussions, assume that people don't know what they don't know. And what that means is that they haven't looked at the temperature projections for their area. What Sam was saying, they don't understand that it's definitely going to get worse. And so one of the main things we can do from a resilience perspective is understand and start to change the common vision of the future to acknowledge that we have a challenge that we definitely have to respond to in terms of just providing healthcare. Because that way we'll all have that same image. And once you start to really think through that in your head, it becomes very, very clear that a just-in-time, single-source, private supply chain is just not going to get the work done. And so I think that there's a lot of sort of allied groups who could come together to really make the case for both a pharmacare plan, but one that's underwritten probably necessarily by a public supplier of the pharmaceutical medications themselves. There's that amazing example out of Toronto of Connaught Laboratories. When I think about what we're going to need, I mean, if we're already having trouble sourcing EpiPens now with our current supply, this is not going to get better. If you think about where we're going, right? So, having worked with MSF in my head, I'm thinking, okay, well, what are the meds we really need to be able to get the job done? Like, what's our national formulary? Can we agree on that? Can we make sure that there's a way that we can, in a climate change future, 20 years from now, near the end of my practice lifetime, when this is going to still be worse, make sure that we have a public supplier that can make that, all of those on the West Coast, Central Canada, East Coast, so we know we can at least do our work in the middle of all of this. At this moment, we can no longer hand over a perfect planet to the healthcare practitioners of tomorrow or to the patients of tomorrow, but hopefully we can hand over the tools they need to do their job. And so I think that that's a really distinct place where we can work together. And meanwhile, if we integrate our narratives and just make it really clear that if we want to, and what I think we're moving towards in general is a narrative around a well-being oriented society. I actually didn't know, but the Department of Finance had 11 people over the course of the pandemic working on a new set of metrics for us, similar to the well-being budget that the New Zealand Treasury has put forward, similar to some of the work that's been done in Ireland. But they've been presenting that with the budget as an appendix, I think, because they think that they don't have the social license to do it. So that work is going there. So if we start to produce sort of a unified voice saying, look, if we want to provide people with what we need, sort of the minimum social and health structure required for life without exceeding the carrying capacity of what Canada's carbon footprint can accommodate, it's only going to work if we're very, very clear about our metrics And that needs to be an entire orientation around well-being. So I think where we're heading is a national narrative centered around an explicit focus on well-being, underwritten by metrics that measure that properly, which will then sort of make us more central to the budgeting process and lead us to a place where we can integrate some of these really clear priorities like pharmacare into the discussion. But I'm really curious because a lot of you know a lot more than I know about Connaught Laboratories and the pros and cons of this. Ryan Miley wrote a commentary in CMAG in like 2011 around Sask Farms. So, there's people here who are much more erudite on these issues than I am, and I'm looking forward to learning from you in the discussion.
Thank you very, very much for that. And now at this point, we'll move into more of an open forum for questions. So if anybody has any questions, Betty Jane, we can start with you.
In Australia, everyone was vaxxed, and now they're coming down with a strange, mysterious disease called SADS. And it's adult. People die of sudden adult death syndrome. What is your opinion of this?
I think it's a bit challenging for some of our panelists to discuss kind of this specific question.
Well, they're doctors. They should be reading up on the news.
But in the context of our kind of discussion tonight, thank you for that question. I think maybe we'll focus on the topic at hand. But Mel, if you have a comment.
In terms of climate change, it's known that food and money is not distributed properly. There's enough food in the world to go around, but it's a matter of distribution. And the same is true of the finances. People seem to be putting in taxes for things such as the military, and war does not allow people to have education and food, basically. Mm-hmm. And also, I'd like to make the point that nobody of the recent generation that I contacted knew what the Romano report was about. That was about the Canada Health Act. It's the older generation who knows that the Romano report was produced with taxpayer money in Canada, only to sit on a shelf and gather dust, which is what happened with the Ontario reports.
I'll just quickly jump in around the question around food distribution and finances. You're absolutely right. We, most years anyway, produce enough food for the population, and power and money result in a real problem with distribution. Inequality is a huge part of this. And because of that, power is a huge part of this. So getting better at evidence-based influence along the lines of what Canadian Doctors for Medicare has been doing for decades is definitely part of this and a really important part of our discussion. So thank you for bringing up the inequality issue.
Thanks so much, Betty. Any other questions from our audience for any of our speakers? I saw some interesting comments from William Bronston. I imagine you're a physician in America.
I got to tell you that the importance of what you're talking about just grips me in the gut. I mean, it's so profound and so poignant and so essential. And, we're in a situation where we are polluting and corrupting the entire world with our privatization and corporatization of our delivery system. We've been working here, a small group of us, to establish a model that we would hope you would look at for some of the areas that you're talking about expanding in terms of the Canadian healthcare system, which is really a relevant model for us. But I just think that we have to carry this conversation to two sources. We got to get to the APHA, which is having their meeting coming up soon at a very strategic level, and also to the leadership of the Physicians for National Health Program here in the United States, which is really the cutting edge of physicians, as you are, for single payer in the state, in the country. And I don't exactly know how to do that, but I would like to help work with Kate or whoever else is in the group to make those connections, to try and replicate this session for those leaders in order to build into them a sense of urgency to carry out this conversation, because it's brilliant. It's brilliant and essential and feelingful in the extreme, and has to be pursued.
Thank you very, very much for that. And we'll be sure to kind of contact you offline and follow up with that. Thank you very much.
I put some recommendations into the chat. The book by Chomsky and Pollan is very much what Dylan is talking about. And the book by Amira Rupa called Inflamed is absolutely a revolutionary book. I mean, she's just a genius woman, a physician at UC San Francisco, and something that you should all be having as right on your bedside to read. It's brilliant, and will really help enrich the conversation and deepen our understanding of where you're going. I'm so grateful to you all. I'm so grateful to you. I can't tell you.
Thank you very, very much for that. Next, we'll go to Shazma, and then we'll go to Mel.
Hi, thanks. Thanks for this excellent talk. So I'm an ER doctor in Edmonton, in Alberta, and I have been a pretty vocal advocate just about our pretty crumbling healthcare system in Alberta. I think it's pretty similar across the rest of Canada, and specifically about Emerge. I've been an advocate and about the pandemic, and our current government in Alberta is quite pro-privatization, very anti-carbon tax, and very pro-fossil fuels. And it's a challenging government to advocate to in the context of climate change, in the context of maintaining a public healthcare system. So I'm just wondering from the panel of experts, what are some specific things that my colleagues and I can advocate for with this, we'll call it a hostile government? Thank you.
Be happy to speak to that.
Yeah. I mean, Courtney probably has some thoughts also.
But you want to go ahead, Courtney?
Yeah.
Or Sam?
I'll just jump in, and then Courtney probably has much more useful advice. But join CAPE, because stuff like this, you can't advocate by yourself. And there is actually a really great CAPE Alberta Regional Committee that's doing tons of great work, and they could use your help. So, and I think there are areas where there's room for advocacy, especially around sustainable healthcare. Yeah, you're maybe not going to change the government's policy on oil and gas extraction, but I think there is room for movement on sustainable healthcare. And I think, knowing who to talk to, especially amongst the bureaucrats and not just the politicians on that file. And I know that CAPE Alberta is currently working on that.
Want to go ahead, Dylan?
Sure. Yeah, I think a lot of it gets back to what Samantha was just talking about. It really comes down to building people power in our communities, building organizations, joining organizations, building movements. Our organization, the Council of Canadians, was involved with many in an alliance in Alberta to fight back against coal mining there, and had some pretty impressive victories, given the nature of the government there, which I think most, if not all, of folks are familiar with here. And really that got back to the same kind of thing. It comes down to organizing in our communities and in our workplaces, because the only thing that corporations and intransigent governments understand is power, and we need to build our collective power and exercise it. And that's how we defeat the power of the 1% and the governments that are towing the line. And I also just put some links in the chat. Both CAPE and the Canadian Federation of Nurses Unions have some really good toolkits for healthcare workers to do climate organizing, and would strongly recommend both of those toolkits as good starting points. And also in terms of some of the work that we've been doing at the council, we've been basically supporting grassroots organizing from coast to coast in a number of ridings with a micro petition strategy, where it turns out you actually only need to gather 25 signatures on a paper petition to ask an MP to introduce that petition. And so we've been using that approach to build support in Parliament for a just transition. And so far, by supporting about 150 organizers in communities in 40 communities from coast to coast, so far 30 members of Parliament have tabled that somewhat intersectional set of demands for a just transition, and another 15 members of Parliament have committed to tabling it, and that includes NDP and Greens and Liberals and even several Conservative members of Parliament. And so like that just, I think, again, highlights that when we organize in our communities, even when it's challenging politicians and forces that we think are insurmountable, when we bring enough people together in our communities, we can win.
Yeah, and I'll just say that Alberta, the Alberta Cape group has actually been quite successful. They were behind a lot of the push to phasing out coal-fired power plants. And that push was done with stories around decreasing air pollution and keeping kids out of the emergency department with asthma. So we produced a report with the Pembina Institute that costed all that out, figured out, okay, how many emergency department visits are we going to save? How many deaths are we going to save? What's the alternative plan? And then Joe Vipond actually held a debate prior to a couple of elections ago and managed to get, I think, all of the political parties except one, except I think it was the Wild Rose Party, to commit to phasing out coal-fired power plants. So that is a really good example of the power of the health arguments around co-benefits that Sam was mentioning, to depoliticize the issue, because really it's not good for anybody when kids are in the emergency department with asthma. They miss school, parents miss work. It's expensive for everybody, bogs up the system. And so the more we can find those areas where everything connects. Another place where people have been really successful is in mapping the places in a given city where the most cyclists are having collisions with cars, and then proposing an alternative map. So one of our former board members at CAPE, Dr. Eric Notbart, did that in Montreal and managed to get the mayor to double the number of bike lanes. Repeated that in Quebec City, and it's being repeated in Vancouver. So the more we can depoliticize things, I think food is an issue. You know, we don't talk a lot about, I feel like food is a bit neglected in all of our conversations right now. We have this great food guide, but when you look at the corporate structure underlying agricultural production in Canada, it's like all the same things that we deal with all the time around pharmaceuticals. Like basically the pharmaceuticals, many pharmaceutical corporations, many of them have an arm that produces agricultural chemicals. You name the game that they've played with us, they play the same thing. They've got, you know, the agricultural colleges infiltrated by lobbyists that then sign people up to sort of branded production campaigns, and then their data gets uploaded onto a proprietary software, and we're subsidizing that. And it's all export oriented and not local food security oriented. And so making sure that we're taking a look at that too, because that's the food we're going to eat. So there's lots of different ways that we can be effective. I'm currently working with a group of Indigenous folks here and in Alberta to try to increase awareness about the untended to tailings ponds around the oil sands. So you may remember back a decade, John O'Connor almost had his license removed by basically saying, hey, like I'm seeing a lot of cancer in Fort Chip, which is just downstream from the oil sands. How about we do a study? We have never done a decent study on that. That was 10 years ago. And so when we talk about environmental racism, this is an egregious example of environmental racism that has been completely neglected by our medical research community. And it's like probably my greatest source of personal shame as a member of the Canadian medical community. And so we're looking now at least calling for a study, because once we put numbers on that, then we have some data that we can use to create the arguments that can make it difficult for even a really captured government to try to ignore a problem. So those are a few ideas.
Thank you very much for that. And we also linked in the chat the link to CAPE, which is such an amazing organization, and everybody involved is doing such great work. We'll turn our attention now to Mel.
Hi, everyone. Thank you so much for sharing your experience and wonderful comments. I'm keeping my camera off because I currently have COVID and it's not a super pretty sight. But my question pertains to my work as a pediatric emergency physician. I recognize that all of us are already being affected by climate change, but we know that the younger population is not only more likely to be affected now, but going forward. And I find that's really a way to get into people's hearts and minds, even if people think, oh, I'm going to be long gone by the time the worst of climate change has its effects. Maybe their children and grandchildren won't be and will suffer from those effects. So I'm curious if there's any particular messaging or responsibility that pediatric providers or people who work with children can convey to families about climate change.
Samantha, do you have any thoughts on that?
Let Courtney take the lead.
First of all, Mel, it's a great question, and validating their fears is the number one thing. So we don't have evidence yet around eco-anxiety and ecological grief. Looking at differing levels within different households, we know that levels of ecological grief and anxiety are skyrocketing within youth. When we look back at the studies that were done around anxiety around the nuclear threat, the household, and there's a really nice article from Canadian Family Physician from like 20, 30 years ago. But what they found was that in the families where the parents were working for peace, the kids knew more about the threat, but they were less worried about it because they saw their adults taking care of the problem. In the families where it wasn't discussed, the information seeped in anyway. And then the kids were terrified because they didn't see the people who were supposed to take care of them managing the threat. And so I've been working as though that is likely to be true now. And so I'm very open with my kids about what the threats are. I mean, they've been sitting here listening to me talk about this for most of the pandemic, but they don't really seem worried about it because like, this is what mom does every day. And so I think that number one, like ecological grief and anxiety are totally normal emotional responses to a real threat. And they don't, in most cases, need to be medicalized. They need to be normalized. And so number one, that. Number two, there's this really awesome initiative, the Pedaling Pediatricians. I don't know if you heard, but around last COP, basically as part of the WHO working group that I'm on, we launched a letter calling on global leaders to basically treat climate change like a health emergency. And it ended up being signed by organizations representing 46 million healthcare practitioners worldwide. And the people who delivered it to COP were pediatricians from Great Ormond Street Hospital. And so they had a sort of relay and they pedaled it all the way up to Glasgow. They handed it over. And that's because the messaging, so Ed Maybach, who's this communications research guru, basically in all his testing, he says that the absolute most depoliticized persuasive frame is to talk about climate change and the health impact on children. So really a pediatric emerge dog is probably the most potentially powerful messenger that exists on this, Mel. And the Pedaling Pediatricians, there's a new initiative this year where they're basically asking pediatricians from different parts of the world to basically have relays where they pedal to the next hospital and then have a conversation, which will be recorded on video with pediatricians at that hospital talking about why they care about climate change and air pollution and active transport. And the idea is to upload all of these videos so that people can see and we can start to change norms around what is our practice and our responsibility. And it's a global effort. They've already got teams from all around the world. So I'll just find a link and send it to you, Mel.
I love so much of that. And maybe just to add as well, we'd definitely recommend for folks here and folks listening to the recording later, if you haven't already, connect with your local Fridays for Future and Climate Strike Canada organizers and get out to support them, find ways of organizing together with them in your communities, because most of our communities have youth and students who are organizing on this right now.
As well as for our kids, which is an organization of parents. So any parents out there, there's For Our Kids groups across the country working on climate change.
Thank you very much for that. And just looking at the time, we'll just move into a wrap up. And I want to start off by really thanking everybody for joining us tonight and kind of engaging with us in this conversation. As I mentioned earlier, if you're a medical student, a resident, a physician, or somebody who's just really keenly interested in these topics, feel free to consider joining our organization. And we have the link in the chat as well. And then also, if you're a CDM member, we'd really love if you could take a few seconds out of your day to fill out a really important membership survey so we could kind of really get to know your needs and provide better services to you as members. As we all know, there's a lot of strength in numbers, and it's really only by coming together and talking about these topics and bringing people together that we can actually bring about real change. And we really, really look forward to working with many of you more closely as an organization, and really, really thank you for being with us today. So thank you, everybody, and have a wonderful night. This will be recorded, and anybody can access access this as well if they would like to listen to it at a later point in time.